Identify the tag structure. Gabby here from Med School Bootcamp, and here we're looking at an image along the aspects of the posterior wall of the thorax. So what we've done, we could see right here, here are the ribs. So we've cut along the more lateral surfaces of the ribs to remove the anterior thoracic cage. So we've removed the anterior thoracic cage, and we've also removed all of the thoracic organs, including the heart and the lungs. Now, if we have a look along the midline of the thorax, so right over here is going to represent the vertebrae or the thoracic vertebrae. And we can see this large vein that is sitting over top of the vertebrae, and this is going to be the azygos vein. And the azygos vein is an unpaired vein that runs along the thoracic vertebrae, as we can see here, but more specifically runs along the right side. We can see along the left side here, we see a couple veins that are draining into the azygos vein. And these two guys right here are going to be our accessory hemiazygos vein. And they'll be draining components along the left side. Versus the azygos vein, as we can see here, is receiving some blood from the right side. So inferiorly, the azygos vein is going to connect with the inferior vena cava. Versus the superior aspect of the azygos vein is going to drain into the superior vena cava. So we have some connections there between both the IVC and the SVC. So if there were to be a blockage within either the SVC or the IVC, the azygos vein can act as a different route or an alternative route for blood to flow. And we could also see along the right side here, we see a few veins that are draining directly into that azygos vein. And these veins are running within the intercostal spaces, so in between the ribs, right? We have a rib here, rib here. We also have rib here, and we can see in between the rib, so right over here, we can see that we have a vein and we also have a nerve that are running in between this space. So this space is specifically called the intercostal space. And within the intercostal space, we have the posterior intercostal veins that are draining blood from the muscles and from the skin of that area. And all this blood's going to eventually reach into the azygos vein. Now, normally running with this posterior intercostal vein, we would also find the posterior intercostal artery. In this image specifically, though, we've removed all the arteries that are supplying. So we've removed the abdominal and the thoracic aorta, and we've also removed all of the posterior intercostal arteries. So running in that intercostal space within the costal groove of those ribs is where we're going to find the posterior intercostal vein, artery, as well as the nerve. So we can see the nerves right over here also running adjacent to these structures. Now, these intercostal nerves are going to go ahead and emerge from the ventral rami of T1 to T11. We'll go ahead and innervate the muscles that are found in between the ribs, so within the intercostal spaces, and also innervate the skin along those intercostal spaces. We could also see some other nerves here, including the sympathetic trunk, which runs more along the lateral sides of the vertebrae. So as far as our question here, so identify the tag structure. So the tag structure is going to be the intercostal nerve.